Welcome back, seniors. Hope you had a great holiday season, and look forward to connecting with you a little bit via email over JTerm and through Moodle. So just wanted to do a little introduction video as to what the JTerm looks like, and I know that your hours will go past the month of January, and so I wanted to discuss that a little bit, but what we need to have take place and get completed during this class. So just a couple of things. Have this as our verse for JTerm. Hopefully it's encouraging to you. And also that I have a prayer request forum set up in Moodle this semester. Remember, everybody can see this in the class. There's 6 of you seniors in this class over JTerm. So if you want to have your share prayer request, please do so here, and praises are welcome. Most of you are in HAS436, and so to keep it just a little more streamlined for me, I've merged the material from 436 and 439 onto the same Moodle page. I did this last semester too. So if you're in 436, which means that you have an off-campus clinical, it's not at Bethel, and I think that's most of you, your syllabus is here, and you have a skills assessment form is here. So let's just briefly look at those first and see the differences. So the skills or the syllabus for 436, which is off-campus, includes this criteria that you need to complete. You have to have clinical hours completed. That's 110 of them in order to pass this course. That's at least 110. If you go over that, that's fine, and in some cases encouraged, because it does look good on a resume, or maybe you're at the U and you'd like to go a few weeks longer. That's fine as long as it doesn't run in and have conflict with your next rotation, which some of you will probably need to email me and talk about that. Clinical assignment form. This is the form that you have to fill out regarding the emergency action plan and the modalities. That form, if you're not familiar with what I am talking about, is right here, clinical assignment form. This is due on Friday. So at 5 o'clock, I need to see that, and I need to have the pictures, and they can be emailed, scanned to me, submitted on Moodle. I don't care, but I need those by Friday. Through this semester, you'll have 3 forum reflections, and I have a little calendar here for JTerm. So I'm going to be posting questions, and you're going to give an initial response by Saturday at midnight every week. And then you have a few days to respond to 2 of your peers' forums, which are due on Friday at 5 o'clock. So you'll do your initial response on Saturday by midnight, and then you have to have 2 responses to peers' reflections. So a week in this course over JTerm starts on Wednesday and goes to the following Tuesday. So if we look on Moodle, the 4th of January to the 10th of January is your week. All right, and then we start the 2nd week, and then the 3rd week, which is really all there is then. Okay, let's see. Skills assignments. This is your proficiencies, and the listing of those for 436 is found right here. So let's pull those up and see what those look like. Fairly straightforward if you're off campus, not a lot. I'm not sure why it's coming up like this. Anyway, you'll be able to see it better when you pull it up. But essentially it's the same thing that you've had in previous clinicals. For this one on your off-campus, you'll do an evaluation, and then you have to come up with an intervention or treatment plan for that evaluation. Your second one is an evaluation of a common illness or condition, and then the treatment plan for that, and then explain referral of a patient to another healthcare provider. All right, you can do those any time through January, but they're due January 26th. And I think I wrote that down on your syllabus. Yep, they're due January 26th. 1 point is deducted for each day that the assignment is overdue. All right. In this class, as a senior, you have a project paper. If this is your first clinical experience as a senior, which would be Michaela and Nathan, you'll be doing a integrated medicine paper, and video presentation. And if this is your second clinical, which would be the rest of you, you'll be doing the faith integration paper. So the information for those is on Moodle here under project information. So 2 of you will click into the integrated therapies project and read the information and what that involves. There are specific due dates for this project, and those are actually written on, this is what you're going to see on the syllabus calendar. And again, this pertains mainly to, I think, just Nathan and Michaela. So it says IT, that's Integrated Therapy Project number 1, due at midnight. So you have something that's due coming up pretty soon. And I'll send you each individual emails as to what your integrated therapy topics are. And then you have another one due the next week. And then you have another one due kind of in the middle of the week. And then the 4th part is due here, and the final project is due on the 26th. You need to click into this document on Moodle this week and find out how far you need to plan ahead, because it involves contacting clinicians, getting interviews, and you need to do that ahead of time and not delay this until a day or 2 before the due date. So stay up on this. The rest of you will do a faith integration paper. And you can click into that document. It tells you what we're looking for, what answers, and the grading criteria on the faith integration paper. Again, I would start these early because they are not that easy just to whip together in the last few minutes. Then evaluation forms will be due January 26th at the end of this JTerm. Case study presentation, that is, again, you can find this on Moodle. Well, it's not on here yet. I will put it on here. Case study presentation. It's the same as last semester. You need to present a case study to another healthcare professional, and then your preceptor will sign it. So this can be a case study presented. Let's see, did I write out guidelines here? I put them on the sheet, so on Moodle, look for case study presentation and it'll be on there. It can be presenting a case to a nutritionist, a physician, maybe a radiologist, anybody except a certified athletic trainer. I want you to find maybe somebody else. So, but that will be on there, and that'll be due January 26th. Okay. So if you're in 439, your syllabus looks pretty much the same. This isn't on campus, so except your number of hours is significantly more. And I know that you've started these already. It's 320 hours at least, or a complete winter sports season. So sometimes that goes less than that, and sometimes that goes more than that. But you have the same types of material or information in that. Your skills assessment for this class, if you're in 439, are quite a bit different. So you have to do an injury evaluation and then a plan for that, a common illness and a plan for that. And then you have to do these little tasks: vitals assessment, respiratory, circulation, demonstrate assessment tools, all of these listed here, do a neurological assessment, GI function, and then psychosocial referral. So make sure you plan those and don't save those to the end. Project information is on Moodle. I just went over that. Course forms that you might need. The forum grading criteria. So this is how I'm going to grade the forums. Bring this up. It tells you how many words are needed. what your initial posts should be. These are the ones that are due on Saturday at midnight. And then your substantive responses to 2 of your peers, what that involves. And those are due on Friday, or I'm sorry, those are due on Tuesday at 5 o'clock. And the grading criteria that I'll use to get those 10 points. All right, that's the reflection there. If your preceptor has forgotten or lost the information on how to grade you for your skills or proficiencies, I have a document here that they can use or just reference. You'll need preceptor guidelines, glancing or reading through those for your clinical assignment number 1, which is due on Friday, as well as the rubric. Forms M and N are the evaluations. Hopefully you have hard copies of those that I gave you already. So coming up here, our week starts on Wednesday. Clinical assignment is due. I need those pictures. I need those forms. Submit them electronically or hard copy. I don't care. But get them to me by Friday at 5 o'clock. All right. For those being late, I'm going to subtract a point every day. So you have to do them regardless in order to pass the class, but you'll get points if you get them done on time. Okay? If you need the form, it's right there. The reflection this week is posted here. Again, it's due on Saturday at midnight, and then you have your 2 responses to your peers on Tuesday by 5 o'clock. And the grading criteria is up on Moodle as well. So answering the questions, responded to others. For 2 of you, the first part of your integrated therapy project is due at midnight, so on the 8th. So get that in as well, and I'll send you an email shortly telling you what your integrated therapies are. So read the information above about that so that you understand what's coming to you. Okay, and that is for this week. And I will continue to post things for the following weeks. I will have, by this weekend, I'll have next week all ready to go. But essentially, it will be doing your reflective forums. I have the January calendar on the syllabus, if you want to look at that. Essentially, you'll be doing a forum posting on Saturday, responding to peers on Tuesday throughout the whole semester, and then working on your skills proficiencies and demonstrating these for your preceptors. That sheet is due on the last day of interim, the 26th, and your project, whether it be integrated therapies project or your faith integration paper. But that's a big part of the grade in this class, so please put some work into those, and I think that should be it. If you have questions, feel free to email me. Otherwise, I hope that things are going well. I think that most of you have started your clinical, so let's get that assignment in and taken care of by this week, and we'll connect with you via Moodle or email in the next few days. Thanks, guys.